Studio by Dr. Owusu-Ansah. And this morning he's talking about wellness care approach.
Sometimes you love too hard. Sometimes you go too.
That is what we're looking at this morning. Doc, you're welcome.
Thank you, Nat.
How are you?
I'm fine. Good to see you.
Good to see you
I
too.
haven't seen you before.
Oh, you haven't seen me before. Okay. So now that you've seen me, what's going through your mind? What are you thinking exactly?
Yeah, good.
I'm good?
Yes.
Oh, thank you.
You
You're
look beautiful.
Oh, thank you. Thank you very much. Also, you hear me, you listen to me all the time, but you haven't seen me.
Yeah, once in a while I listen to Star FM in
okay.
the morning, especially if I'm not busy or if I have somewhere to go and I'm driving in
Okay.
town. I'll listen to your
Right.
time.
Okay.
The
Oh,
branch.
that's good to
And
know.
then I hear your name.
Yeah. And then
Nathalia.
finally you've seen me,
Yes.
Nathalia.
I never thought I was going to meet you one day. No.
Oh, well,
Yeah.
today is that day. Today is that day. It
Yeah,
feels good to
so
have you.
It's good to have you too.
Yeah, Dr. Owusu-Ansah. So today we're talking about wellness care, right? This conversation comes up every now and again. But first of all, tell me, where are you from?
Okay.
And what exactly is it that you do?
Right. So I'm from Healthy Soul Medical Center.
Okay.
So Healthy Soul Medical Center is one of the alternative health facility.
Okay.
When you say alternative, we kind of using herbal,
Okay.
homeopathic, and then other stuff to manage chronic diseases.
Okay.
Yes. So that's where I am coming from. And
Right.
we at Kaneshi.
Okay.
It has been rated one of the best health facility or alternative health facility
Okay.
in Ghana.
Okay.
Because
That's
we
wonderful.
practice evidence-based medicine.
Okay.
And then you use the WHO mandated laboratory investigation to do our work. So you can't come to Healthy Soul without a lab investigation and then we'll just prescribe for you. You always have to get our investigations done and then we get them accurately before we prescribe or before we give you the management or the treatment.
Oh, that's wonderful. That's wonderful. I think I'll come and visit your clinic.
You have to. You
I-
have to.
yes.
You're actually running a promo or you're doing a package. That's why I'm here. So
Right.
probably
Well-
the whole of this month or the whole of this year, people will hear a lot about wellness healthcare approach.
All right. So let's talk about wellness care. When somebody says wellness care, what exactly does it mean?
Yeah, I'm sure we are all well
Yes.
because you don't have headache. I don't have headache.
Actually, I do have a little headache.
Okay. So
This morning I woke up
Okay,
with a little
so
headache.
talking about wellness healthcare approach, we want to emphasize more on the non-communicable diseases.
Okay.
Because those are the things, or those are the area which you do not have the signs and symptoms early,
Okay.
unless it gets to certain stages. And when you do medicine, when it comes to the non-communicable diseases, we have them in stages. For instance, if you're having kidney disease, we have kidney disease stage up to stage 5.
Right.
We have it from 1 up to 5. And Nat, do you know that unless you are at stage B or 3B, before you see that your kidney is getting damaged?
Oh, right. I didn't know that.
Yes.
Okay. So it starts 1,
1,
2, 3,
3A. You will not
3A,
you will not see anything
right.
unless you get to stage 3B. That is why there are a lot of cases these days.
Okay.
And for Healthy Soul Medical Center, being in the field for almost 20 years, we've realized that Africa, Ghana as a whole, we are not practicing, this kind of
Wellness
approach,
care,
wellness.
yeah.
I live in other places, Europe, France like this, Germany like this. You'll be there every 3 months, depending on your age, you need to go for checkup. And then you go for
Right.
checkup for some of these things, non-communicable diseases,
Right.
liver problems, kidney problems, cancers, all these things. It's mandatory. If you don't go,
Right.
you have a fine to pay.
Wow.
Does it happen here in
No, it
our part
doesn't.
of-
No, it doesn't. And every time I say that, sometimes it's the economic factors, because there are some people who they will never go to the hospital unless they feel like okay, I think I'm going to die. That is when they would go.
And they
because-
actually go and die.
Yes.
I'm not cutting you.
Yes, because they
They
feel like
actually go
Yeah.
and die.
that
Because
is the only time they
that's
go.
it.
Because
emergency, you
yeah.
are there. The last time I was on different media station, and the presenter was chastising health professionals, especially the nurses, that when they come they'll be fidgeting on their phones and they'll be. I said no, it's not like that. You see, when you come to emergency center, we call something triage. Okay, so we triage our patients. So for instance, here is a hospital, is an OPD or is an emergency. So Patrick will come with probably RTA, road transport accident. He's bleeding, profusely. Somebody will come with abdominal pain. Oh, me yeah. We will not attend to the abdominal pain, that patient. You will seek to the person who is bleeding.
Yeah.
So that's how we do at emergency.
Okay.
So if you stay at home for your condition to, travel to that end, and then you go and you don't get that attention that probably you were looking for, then you might be disappointed.
Yeah. Yeah, I
Which
see what you mean.
Shouldn't be so.
I see what you mean.
You
So
should
the
be
wellness care
proactive.
is very important for us.
That is it.
Also because because of doctors' notes, I've been having conversations with a couple of doctors every now and again. And one of the things that they talk about a lot is Ghanaians love to self-prescribe,
Exactly.
Yes. medication
Yes.
to themselves.
Yes.
Like
Yes.
when I have a headache, I just go to the nearest pharmacy and tell them that I want to buy this.
Everybody is a health worker here. Everybody.
And even prescribe antibiotics for themselves. These days, because of
Yes.
Google, people can Google
Yes.
symptoms
Yes.
and Google medication
Yes.
and just go and buy it.
I fight with them all the time at my consulting. Please don't bring your Google medicine to my consulting room.
Right.
Google medicine is different from what we have done from clinicals, from the training. Okay? So if you have a problem, you've Google it at Google. Anybody could put anything at Google. Anybody
Yeah.
at all could
Yeah.
put it there. So they come and they say, I Google it and it's like this. I said, please. If you
Yeah.
know, then you have to go and treat by
It's
yourself.
by yourself. Also, because a lot of symptoms mimic each other.
It's like that. Every condition. I had a client which came and they were actually treating kidney disorder. Meanwhile, it was a liver cancer. Can you imagine that? Because they've Googled, then realized that, okay, if you have kidney problem, you have pedal edemas. That's your leg gets swollen.
Yeah.
Your abdomen begin to bloated. That's you have
Distend,
ascites. You have so because they saw that, then they started cooking some plants, cooking some herb, and then when they went to one of the biggest facilities in Ghana here, they went there to say they have kidney problem. I don't know whether that the doctor too didn't do the due diligence and then started managing kidneys. Yes, so the swelling, the edemas were there, the abdominal swelling were there. So somebody directed them to my facility. They came. I listened to them. I am the type who always think outside the box.
Yeah.
I don't just listen to you and then I always think outside the box of what I hear from my clients. So I said, okay, fine. You've been treating kidney problem. He said, yes. I said, so how have you been doing? I mean, you've been given medications to manage the kidney disease. And then I ask, what is actually wrong with the kidneys? Because we have other conditions. We have conditions like kidney stones. We have cysts in the kidneys. We have other pyelonephritis that could actually destroy the kidneys. So in your case, what is causing your kidneys to damage? He said he doesn't know.
Wow.
Right. So I said, okay, then. So we did a couple of tests to do. Nat, I did the kidney function test, and the kidney was so fine.
Oh, right.
The kidneys were so fine, but liver was fat. Almost 3 out of the 4 of the liver strength were gone.
Oh, right.
So these are some of the things you are talking about. So
Yeah.
wellness, when you talk about wellness clinic, we don't want you to get the condition before you go to the hospital. Start now. start now. When you are fine, that's where you begin to see your doctors. That's where you could ask questions. That is where you could act on your right senses.
Right.
Not now, if you are having severe chest pain, dizziness, and then you come to me, anything I suggest, you do.
True.
Anything I suggest, you do it.
I don't even ask questions
You won't ask anything.
because I just want to feel better.
Exactly. But when you come with healthy mind, no pain, sound mind, then I say, okay, Nat, let's go and do liver function test. Let's go and do kidney function test. Go and do a chest x-ray for me. So you come with all your results, and then I say, oh, Nat, your enzymes, your liver enzymes, probably your gamma glutamate transferase supposed to be maybe 80 and yours is 90. Then you can say, okay, so daddy or doctor, what is causing?
Yeah. What do I do?
What do
do
I
we
do?
do to make it better?
You understand? When you do your renal function test and then the parameters, your potassiums, your calciums, creatinine, urea, all these things supposed to be in normal shapes or normal figures, values. But then yours, you have probably low, you have highs, and that's, oh, now your EGFR is this, which is supposed to be like that. Then you could ask your questions and then find a better solutions to it.
Interesting. So